My name is Sundus Lodhi. I am a transplant nephrologist and medical director of the Kidney and Kidney Pancreas Transplant here at Piedmont Transplant Institute. So today we'll be talking about a case study that involves belatacept conversion, CNI withdrawal, and the use of Prospera and how that was helpful in managing this patient. We'll start with our patient who is 63 years old. She underwent a living unrelated kidney transplant and did really well, smooth surgery, quick admission. But about 6 weeks later, we found that her creatinine really hadn't settled down to where we wanted it to be. It was still stuck in kind of the 2 range. So that prompted us to do a biopsy, which showed no rejection, but did show some tubular injury and a little bit of intimal fibrosis. So we decided to withdraw calcineurin inhibitors slowly with conversion to belatacept, as we do with many of our patients in this scenario. At the time of calcineurin inhibitor withdrawal, we start to screen patients with more frequent labs and also add Prospera screening to pick up on rejection or kidney injury a little bit earlier. We know that patients who are coming off of calcineurin inhibitors may have a higher risk of rejection, particularly early post-transplant. So we use Prospera testing as another method of surveillance in addition to our routine blood work and donor-specific antibody monitoring. This patient had calcineurin inhibitor withdrawal about 6 months after her transplant, and we noticed an increase in her surveillance Prospera test that went into the high-risk range. Her serum creatinine remained somewhat stable at around 1.7. However, we went ahead and proceeded with biopsy because our suspicion was high based on the timing, the immunosuppression reduction, and also the Prospera surveillance. That biopsy revealed a 1A acute cellular rejection along with a V1 component. And her creatinine really had not changed by the time we got the biopsy result back. So we treated this patient with steroids because we caught this rejection early, and she continued to do very well with no real increase in her serum creatinine. Subsequent surveillance Prosperas came back down to low risk and remained in the low risk range, which gave us the confidence that the kidney injury was resolving and stayed resolved. We continued to monitor her labs and her Prospera surveillance about every 2 weeks for about 2 months, and then we reduced to once a month, and she remained stable. So at 2 years now after her conversion and treatment for rejection, she remains with stable kidney function, and we're reassured with her Prospera surveillance that she continues to do well.